My name is Manuel Sanchez-Casalongue. I'm a general surgeon with Rush Copley Medical Group. As a general surgeon, I've been trained in doing a broad variety of surgeries, going from skin surgeries, what we call the lumps and bumps, to intra-abdominal surgeries, gallbladder, appendix, colon, to other more advanced procedures. Specifically in fellowship, one of the things I trained was in doing foregut surgery, and that is the surgeries of the esophagus and the stomach, and many of them doing anti-reflux procedures. So it's one of the key specialties that I have. During fellowship, I did nearly 150 anti-reflux surgeries, which is really more than most surgeons see in their careers. I pretty much do all my hernia repairs, gallbladder, appendix, everything with tiny incisions. And I think it really helps patients first come back to their normal activities more easily. So there's less pain from the incisions. They can get back and walking around and doing everything they need to do at home more quickly. When I see a new patient in the clinic, what I try to do is really put them at ease. For a patient, it might be the first time that they're seeing a surgeon, or it might be a problem they're worried about or embarrassed about. So I do my best to take the time to sit down with them, talk to them, and explain in really clear terms what I think is going on, hear their concerns or their symptoms, and then try to come together to a plan that's going to alleviate that concern or take care of the issue. I think it's very important for me to see my patients after the surgery. The surgery for a surgeon is the one event in the operating room, but I think it goes beyond that. I think it's the preoperative visits when the patients gain trust in the surgeon and they decide that they're going to put their bodies under our care. And then also the visits afterwards, which is when we really get to make sure that everything went according to plan. And so taking the time to discuss with them what happened and review any results from the surgery, I think is really helpful. I think in the end, when I think about patient care, I just want my patients to be happy and proud that they chose me as their general surgeon. I want to make sure that I was able to address the issues they had and to help them as much as I could. And in the end, that I also improved their quality of life. And I think the highest compliment that they can give is if they tell a family member or a friend, you know, I have this good general surgeon, why don't you go see him?